Canada, governments of all levels are working to slow and stop the spread of COVID-19, and while at the same time protecting our most vulnerable populations. Nowhere is this more evident than in our long-term care facilities. These places are home to thousands of our parents, our grandparents, and our loved ones. They gave so much of themselves to ensure that we have a better life. And now it's our turn to make sure that we take care of them. That is exactly what we are doing in our whole of government approach in our fight against COVID-19. Our frontline healthcare providers have been working tirelessly through this crisis, and the women and men of the Canadian Armed Forces have joined them, working beside them to keep our seniors safe. Over the past weeks, both Ontario and Quebec requested the assistance of the Canadian Armed Forces in their provinces' long-term care facilities. Canadian Armed Forces reconnaissance teams moved quickly into Quebec and Ontario to assess specific needs to support planning for deployment of personnel to support in these long-term care facilities. And in Quebec, we have already been supporting 13 long-term care facilities. And as of today, the Canadian Armed Forces will have over 1,020 personnel committed to the support of 20 long-term care facilities, with over 670 medical and support personnel will be contributing inside the facilities, while nearly 350 members are providing essential day-to-day support, such as delivering personal protective equipment and other needed supplies, maintaining a liaison with the province, as well as planning to refine operations to better support the patients of those long-term care facilities. And as we speak, we are working to deploy additional teams, bringing the Canadian Armed Forces support to a total of 25 of Quebec's long-term care facilities in the Montreal area by mid-May. In the following week, when deployment is complete, we expect to have over 1,350 members dedicated in helping our loved ones in long-term care facilities, and we continue to work with Quebec to support them in their need. Meanwhile, in Ontario, there are approximately 265 women and men in uniform who are actively providing support to 5 long-term care facilities. We are working day and night in long-term care facilities in Pickering, Scarborough, Etobicoke, North York, and Brampton. Though this is not a typical Canadian Armed Forces operation, the Canadian Armed Forces can adapt to any situation, and they do it well. And I can assure you that our people have been properly trained and are equipped and are up to this task. Members have received instructions in how to integrate with health services staffs. They have been trained on the use of medical-grade personal protective equipment, and they have also received a long-term care facility orientation facilitated by the provinces. We know many Canadians are worried about their loved ones in these facilities. They're concerned for their health and the added stress of the isolation that our parents and grandparents are experiencing. It is why when Canadian Armed Forces have been called on to serve, they are there in their time of need. And they will do whatever they can to help healthcare providers in these long-term care facilities maintain the health and well-being of vulnerable Canadians. While some of our members are deployed to long-term care facilities in Quebec and Ontario, many Canadian Armed Forces members are responding to various requests for assistance across the country. And I continue to work with Minister Miller and Minister Vandel to support their efforts to help our northern Indigenous and remote communities across Canada. In northern and eastern Quebec, there are approximately 200 Canadian Rangers supporting 26 different communities, helping local health authorities limit the spread of COVID-19. They are educating people about physical distancing, supporting the work of healthcare personnel, and assisting with the delivery of community-owned supplies. And in Saskatchewan, Canadian Rangers are providing critical support to communities of Walston Lake, Île-à-la-Crosse, and Fond du Lac. We have also Canadian Armed Forces members in Ontario assisting Public Health Ontario with contact tracing. They have already contacted hundreds of Canadians to help monitor and slow the spread of COVID-19 in our communities. And just last week, when Minister Anand informed me that there was a shortage of swabs in Nunavut, we worked cooperatively together to get this critical material up north. The Canadian Armed Forces members are helping the Public Health Agency of Canada manage PPE in warehouses across the entire country. And behind the scenes, civilian and other defense team members are helping out in a number of ways to ensure that these deployments are possible. They are working alongside a number of federal departments, for example, to fund research and innovative solutions to COVID-19 challenges. And our defense scientists and researchers are also working hard to apply their expertise to develop solutions. In addition to COVID-19 efforts, Operation Laser, defense team members stand ready at all times to support Canadians in the face of any domestic emergency. As our personnel in uniform continue to deploy into various communities to protect the health and safety of Canadians everywhere, and their health remains our #1 priority. And since the beginning of this operation, we have released clear guidance on how Canadian Armed Forces members can remain healthy and adjusted to operations to protect our personnel and provided them with the necessary PPE. Throughout this pandemic, our focus will remain on keeping the forces healthy so that they can be ready to help Canadians when called upon. And we continue to work with public safety and our provincial and territorial partners to monitor the flood and forest fires risk across the country. And the women and men of the Canadian Armed Forces stand ready to help if it is requested. The women and men of the Canadian Armed Forces and the whole civilian defense team will always be there to help Canadians. We have done so from the beginning of this pandemic, and we will continue to do so. Thank you very much.